Hi, how are you doing? In today's video, I'm going to show you 3 safe exercises that anyone can do to strengthen their knees. If you don't know me, nice to meet you. I'm Dr. Alexandre Mota. I'm a physical therapist, I'm an osteopath, and it's great to have you here. Take a look at this question. Dr. Alexandre Mota, I never miss one of your videos and I always share all of them. I've helped a lot of people. I'd like some exercises to strengthen the knee and legs. I've had COVID 3 times, wow, and I feel like my legs have gotten weak. I've already made a video talking about how to relieve heaviness and numbness in the legs after COVID. I've linked it in the card for you to watch after you finish this video. Before exercising, you need to understand that your knee is always in a tug-of-war situation. Remember that game you played as a kid? Where 2 teams pull on a rope to see who can pull harder. And sometimes everyone is pulling so hard that the rope doesn't even move. Everyone tries, but the rope just stays balanced. So that's what's happening with your knee. Pay attention here, look. Here we have a knee viewed from the side. This bone up here is the thigh bone, the femur. This bone down here is the tibia, the shin bone. And here, this little triangle is the patella, it's the kneecap. And if we look, let me grab my little red marker here. If we look here in the front, we have the thigh muscles, the quadriceps, which are actually 4 muscles, right? Pulling here at the front part of the knee. And we have several muscles that go behind the knee. In other words, the knee is surrounded by muscles. We have the muscles at the back of the thigh running behind the knee here, and we also have the calf muscles. A lot of people don't know, but the calf muscles, the gastrocnemius muscles, they come from the foot, form the calf, and go up to the knee. So look at the difference in strength between the muscles in the front and the muscles in the back. And the result of this, when you don't work on it, you have an imbalance in your knee, is that these big muscles in the back start to accumulate tension and the muscles in the front start to get weak. And then that tug of war, that balance of forces starts to disappear. Your knee becomes unbalanced, then it starts to wear out. You start to have a series of problems, tendinitis that you weren't supposed to have. So to strengthen your knee, you need 2 things. Let me grab the green one here. It's easier for you to see. You need 2 things to strengthen your knee. The first one, of course, especially in the muscles in front of your knee, you need to improve the strength and control of those muscles. And the muscles in the back, they need to learn to relax. They need to be more flexible. So quote unquote, you need stretching. So there is no strengthening of the knee, no strong knee, without the strength and control of the muscles in the front and the relaxation, flexibility, and stretching of the muscles in the back. And now that you understand what your knee needs to get stronger, I want you to tell me a little more about this pain, this knee problem that's been with you. Can you describe how the pain began? Was it from a fall? Did it appear suddenly, start mild and worsen, or begin strong? Can you tell me what makes this pain worse? And can you tell me what makes this pain better? For example, for a lot of people, the knee hurts when you sit for a long time and then get up. For other people, the knee hurts when they walk for a long time. For some people, walking actually makes it better. So, tell me a little more here in the comments about what this pain feels like, what this knee problem is like, so I can help you. I can answer your question, or maybe even record a video answering your question to help you in the best way possible. And then you need to stay sharp, because there are a lot of people for whom I record a video answering their question to help them, and they don't even know that I answered their question or that I recorded the video. So, to make sure you don't miss the answer to your question, subscribe to the channel, turn on the notification bell, and select all notifications, because then YouTube will let you know when there's a new video, and when I answer your question, you'll be notified. You look like a butler ringing that little bell, Jaime. Jaime? Yes, ma'am. So the first exercise will be to improve the strength and control of the muscles in the front of the thigh, the quadriceps. I made this little drawing here so we can have an idea more or less of how the muscles in the front of the knee work. Here I have 3 of the 4 muscles, okay? Here is a muscle called the vastus lateralis, which is on the outside. The vastus medialis, which is on the inside, and the rectus femoris. And underneath them is the vastus intermedius. So there are 4 muscles that attach to the same place. So this exercise I'm going to show you now will be to strengthen these muscles, but working on patellar alignment. And the first exercise we're going to do is the squat. I know a lot of people are thinking, Alexander, I can't do squats. The doctor said I can't do squats. If I squat, it hurts. I can't squat. Calm down. We're going to work, as I said at the beginning of the video, in a safe way. So, take some precautions. First, I want you to pay attention to how far you can squat without feeling pain. Some people can only squat up to here. Here, if you go past this point, you start to feel pain. So you'll do the squat only up to here where it doesn't hurt. All right? Some people stay higher up here. Some people can squat even lower. So you'll look for a range of motion, a position where you can squat without pain. It doesn't matter if it's bigger or smaller. What matters is that you're waking up and strengthening these muscles. All right? So slowly you start squatting, lowering yourself until it doesn't hurt. You reach the point where it still doesn't hurt. If you go further, it starts to hurt. You will hold this position. Stay here for between 15 and 30 seconds. Ideally, you should stay for 30 seconds. Notice a few things. Don't let your knee fall inward. Try to keep this alignment. If I look here, I can see my knee is exactly above my foot. It's in line. The eye, the knee, and the foot. If the knee is inward or outward, it's wrong. I'm putting too much strain on my knee. Keep this alignment and try to stay here for 30 seconds. If your leg starts to shake, or if you can't support your body weight anymore, it feels like your muscles are giving out, it's because you've reached your limit, you've reached your maximum. In that case, you sit down and rest. I want you to do this exercise 3 to 5 times a day. It doesn't have to be all at once. You can spread this exercise out. Do it throughout the day. Remember that this is a strengthening exercise. You will start to feel this improvement, your knee getting steadier and the pain decreasing over the next few days. So you have to do it every day. I recommend that you start with the minimum. Hold the squat for 15 seconds, or if you start shaking, if you can't support your body weight. In other words, if you fail, you do this once or twice and observe how your body will react. If you haven't exercised in a while, your legs might be sore the next day. And if you feel that soreness all over your thigh, it's a sign that this soreness is strengthening the muscle, that you used a muscle you weren't using before. The second exercise is to start stretching the muscles behind the knee, starting with the thigh muscles, the muscles at the back of the thigh, okay? For this, you will sit in a chair with your feet flat on the floor and you will simply let your body lean forward. Try to do it in a way where you don't bend your spine. I don't want you to make a C shape with your spine. You know when you're in the car and you're going to adjust the seat and you move it here? Yep. And you raise or lower it so you keep your back straight the whole time? So you're going to lean forward as if you were adjusting the car seat. Keep your back straight, keep your posture elegant, and lean forward, maintaining the curve in your spine, okay? It's like you're sticking your butt out. You'll reach a point where you'll feel a stretch in your butt and the back of your thigh. That's the stretch we're looking for. If we do that traditional stretch where you put a towel or a strap around your foot and pull, a lot of people have back problems, have sciatic nerve issues, and those issues can get worse. This way of stretching here, we're stretching the muscles around the knee, but without putting strain on the knee or the back. Sit on the car seat. You can even put your hands on your knees. The important thing is to keep your back aligned. Go as far as you can. Do you feel that it's stretching? Great. You should also hold this position for between 15 and 30 seconds. Ideally, you should keep the stretch for about 30 seconds, stretching well. And the third exercise is a stretch for the muscles at the back of the knee, all of them. For this, you will stand up and use a chair. I prefer a chair, but you can use a counter, a table, or a bed, okay? I prefer a chair because here's the thing. The first thing you're going to do is unlock your knees, just bend them a little. A lot of people keep their knees fully extended, locked, and sometimes it even causes what we call genu recurvatum, that knee that bends backward. I don't want that. Unlock your knees and remember the car seat. You're going to lean forward, keep your back straight, and stick your butt out. Do I prefer the chair? Because of this, as you go lower, there comes a point where you can move the chair a little bit and you still stay well supported. Go down as far as you can while keeping your spine aligned, keeping your back straight, and feeling the stretch behind your knee without pain, okay? If you try to straighten your knee here, you'll see that it will hurt and you'll feel a different kind of pain, a pain that feels like it's burning. We don't need that. With your knee unlocked, lower your back with your spine straight until you feel the stretch without pain. In this position, you'll also stay between 15 and 30 seconds. So to simplify, I suggest you do sets of exercises every day, always starting by improving the strength and control of the muscles in front of your knee with squats and then doing stretches. First the muscles at the back of your thigh and then all those muscles that go behind your knee. In fact, I've already made a video showing exercises to help those who feel pain behind the knee. I've linked it in the card. And if this video helped you, if you learned something new, leave a like here. Your like helps you, helps other people, and helps our channel grow. And pay attention because I'm saying this is our channel, because I want you to use this video, this tip, and all the tips here on the channel to help those who need it. Help someone who is close to you in your family, at work, who is in pain. Bring them here to subscribe to the channel, send this video to them, and that way we can help more and more people. And right here on the side, there's a video about knee pain relief in 1 minute, where I show how to improve a major cause of knee and meniscus problems. Down below, there's a playlist with all the videos that can help those who feel knee pain. So binge watch. I'll stop here for now. Big hug and see you next time. Woo.